good morning, and thank you so much for joining us. My name is Lillian Muli, and on this morning's show, we're talking about hair loss. August is Hair Loss Awareness Month, and this morning we'll be looking into what impacts your hair health. Can hair loss be stopped? Is it primarily an issue that affects males through balding, or can it affect females and even children? We'll be unpacking this with the help of my guest in studio this morning, Dr. Winnie Maina. She's a registered clinical officer and dermatologist. Thank you so much for joining us, Doc.
Thank you so much for having me.
Let's begin with how big a problem hair loss is in Kenya today.
Quite big, especially in the Black population. This is where we lie. We say about 50% of the population, particularly women, will go through hair loss at some point in their life. And in the most recent past, we are seeing very young men, as early as 20, 25, coming with hair loss, which it was initially used to be seen in older men. Yeah, so it's quite something right now.
So we're seeing a shift where, like you say, younger people are starting to lose hair. Let's classify the hair loss, starting with the younger men, which is what you pointed out first. Younger men are losing hair earlier. What would you attribute to this hair loss, and how young is young?
At the background, especially if I shift the context to men, their hair loss is quite narrow, is not as broad as women. And I see it as especially because of the androgenic pattern, their uncles, their fathers, or you can see it in the family history. However, previously, even in literature and studies, we used to see this starting to happen at 40s, 50s, and we're now currently seeing it as early as 19, 20. And it's something that we're trying really to look into. Some of the papers in the recent studies have started to associate these with the lifestyle changes that we're seeing. The background is they'll have to have the genetic predisposition to the androgenic alopecia. They have their father, their uncles, or they can see it in the family. But a certain shift in terms of lifestyle, stressors, diet, and all that is giving us such occurrences happening early in life than we should have expected. Yeah.
When you talk about life, okay, so before we go into lifestyle, you had also talked about women, and just going back to women, you know, there's some habits, for instance, the braiding of the younger girls. Back in the day, the places where, you know, girls used to be taken to be braided, the very tiny braids. I don't want to mention the places. But, you know, so the thing is, going back to habits, you know, of even like the stress on the hairline in terms of women, could that be a contributing factor? But also when you look at women and talking about them losing hair earlier, what are we looking at in terms of the potential cases away from the stress on the hairline?
Women particularly is a unique population because of the unique biology. Other than the attraction because of pulling, plaiting and braiding, there are hormonal factors, all right? Women are the same population going through childbirth. You've seen people, you know, lose hair after delivery, hormonal issues, medical condition like even polycystic ovarian syndrome, thyroid dysfunction. So when we are assessing hair loss, particularly for women, it's a very unique population. It's not as straightforward as it is in men when we are diagnosing hair loss. So previously you would find, especially if we compare the demographics in the urban and the rural population for women, you find girls and younger women in the urban population than in the rural village losing hair more because of, you know, lifestyle. We start taking our children as early as months, years, 2 years, 3 years to the salon. And then we have this notion whereby if you do it tightly and neat, it will last longer. But by the time they're coming home, you can actually see pimples, or that particular night they can't sleep because it's painful, and if it hurts, it means there is trauma to the scalp. So the response to this trauma eventually ends up giving us hair loss at some point.
Right.
Yeah.
And now we've talked about, and you just taken me back to that extreme migraine that, you know, so you've had your hair done, and this is a child, and then, you know, you experience a migraine, and this continually happens, and this continually happens. What should parents look out for in terms of even just not even the tight braids, but there are certain children who, anytime there's that interference, that braiding, that just touching of the scalp, and you know, having any sort of braids, or whether they're tight or you know, the bigger ones that we're seeing nowadays, what are the lookout factors that parents should look out for in terms of potential hair loss after salon visits?
And actually, thank you so much for having this conversation, because the players move from parents to ourselves as the practitioners to even the stylists, the people in the salon, the barber shop, because when that child comes home and you can see redness, you can see little pimples along the hairline, that makes you know that this is totally tight and interfering with the scalp. So the conversation now goes to where you're taking your child for, you know, hairdressing and all that. Your stylists, most of them, they're very friendly, and it's obvious you can have the conversation with them. Let's just have them neat, but not very, very tight. If the child says, if you walk into the salon, you'll see them moving. Even when this is being done, they're moving a little bit, they're, you know, expressing pain. That just shows we are traumatizing the scalp. And at some point, we start seeing even traction alopecia very early in life. I'm seeing as young as 9, 10-year-old, 15-year-old, which is quite early in life for them to have traction alopecia.
Let's talk about traction alopecia. The first that a celebrity came out, and this is globally, talking about alopecia was Jada Pinkett Smith, Hollywood star, and she spoke about hair loss, actually said that she was experiencing alopecia. Now you're talking about traction alopecia. Please unpack this for us.
Traction alopecia is mechanical and can be prevented. Unlike other conditions of alopecia that we're talking about, autoimmune, hormone and all that, traction is something that we have complete control over, because it's only inflicted by either our stylist or ourselves because of the trauma. So what can you do just to keep away from traction alopecia? The tight braidings that we're talking about, it has to be done loosely and effective enough that you're not in pain and you're not hurting. Most of us will end up keeping the styles even for more than 10 weeks. We strongly recommend that if you have a style, maximum 6 to 8 weeks, get it undone, and then give your scalp a break to breathe, and these are the time you shampoo, condition, and at least treat that scalp. This gives your scalp time to regenerate and heal. And over time, because of that, you plate, there's a break, your scalp is getting nourished. We end up minimizing the traction alopecia. Protective styling, you see that some of us who have the privilege, we can do some cornrows inside, wear a wig, and give that hair a break for some time. If you have, like, simply in the most recent past, the box braids, just gently done. But I'm seeing a trend whereby the braids are moving all the way to the back or to the knee length. The weight is so much for the hairline. Or if you have to do the braids, you need to hold them up in a band, because you reduce the tension on the scalp, and that ends up managing the traction alopecia majorly.
Right. Now, Dr. we've got some images on our screens, and I'd like you to look at these for us and tell us from a clinical interpretation what you're seeing when you see a head or a scalp that's displaying such are they symptoms? Are they? So when this happens, clinically, what are you seeing here? Interpret this for us.
I've seen there's one I can see 5 months post-operative. That is post-hair transplant. This is a man, obviously, presented with genetic balding, and hair transplant is one of the restoration procedures that are done for hair restoration. And there's another one below.
Let's look at more images. So away from this, because this looks like a procedure, but let's keep scrolling through the images and take a look at how extreme this can be. So where we have that marker on that gentleman's head, let's talk about what happened there. Is that genetic? Are those lifestyle factors? Is that the traction alopecia we're talking about? What exactly is that?
This is genetic balding. what you're talking about, the androgenic alopecia. Typically in men, it will affect the forelock, the vertex, and the crown. Hardly will you see a man balding on the sides and the back. And particularly for men, it becomes very easy to manage their hair loss. Very few who present with something else beyond the genetic balding.
Right.
So when the hair transplants are done, you just harvest and get hair from the sides, the back. That particular hair is resistant to genetic balding, so it moves to the front with its genetic characteristics, which is resistant to balding, and they end up having the hair back again.
Yeah, we'll talk about remedial options.
Yes.
However, you talk about the balding mostly being at the front, but we know some people also complain of balding in the middle.
Yes.
That's the middle of the head, the middle part of the scalp, which then starts proceeding. It starts kind of... somehow I don't know. Yeah, so it starts in the middle and somehow starts expanding in terms of the scope of the balding.
Yes.
Yeah.
For women, if the balding especially starts in the middle, through the clinical examination and a bit of history, the diagnosis almost changes. Because there are things that we have seen recent past, especially in Black women, things like CCCA, centrifugal alopecia, which is a scarring form of alopecia. This can occur at the same time with androgenic alopecia, or what we're saying genetic balding. So classically, when you go deep into examining and getting the history, we're able to take them through some screening in terms of medical investigations. Some we end up doing even something called scalp biopsy, so that we have the diagnosis right. If the shift or the diagnosis shows any inflammatory process, they then are not candidates for hair transplants, because if we go ahead and do the hair transplant, they end up losing that hair all over again. So hair loss as it is, I know most of the time people used to think it's vanity, but it could just be more than that. It could depict a medical issue. It could depict a systemic medical issue that someone is going through by the time they come for a consultation.
I'm glad you pointed that out. When a patient first comes to you,
yes,
when they experience hair loss, what do they complain about? Are they concerned about their looks? Is there a health concern that there could be an underlying medical issue? Or has this taken an emotional toll on them?
By the time they come, it has an emotional impact. It's self-image, self-esteem, and somewhat has injured how they feel about themselves. But the most unfortunate bit we see, by the time they come, they already have lost more than 50%. Because for someone to know that you've lost hair, if I look at you and I know you've lost hair, you need to have lost more than 50% of the hair. So most of them present not because of the actual pain, because most of the hair issues or hair loss issues are not painful, but because of the emotional pain and the emotional impact that it has had to their self-image. So then that is when we take them through the holistic approach in terms of history taking, clinical examination, and to some extent, mental health specialists have had to come in because of what it is to them. They can't walk, they can't go to social function, they can't even open their wig or anything. They feel some type of way about the hair loss. Yes.
Now, in terms of deeper health problems that we talked about, possible underlying health issues that a person may have, and I know you talked about taking the history of the patient and finding out exactly. So what are some of these health issues that could actually lead to hair loss that perhaps may be overlooked? Because we'll get into the myths and what traditionally people, and all these quick fixes that people would fast go to. That would be the fast go-to when you experience hair loss. But common underlying health issues that are often overlooked.
Okay. Other than the traction alopecia we are saying because of the mechanical things, we have typical scalp diseases that can have you lose your hair. Things like psoriasis, eczema. People will always say seborrheic dermatitis, my scalp is always flaky, and before we know it, they have lost hair. People with thyroid dysfunction, maybe they have a thyroid tumor or their hormones are not behaving right, they'll present with hair loss. People with things like polycystic ovarian syndrome, they'll also present with hair loss. And then also recently we are seeing mineral deficiencies. Something simple as vitamin D deficiencies. As a Black population, the prevalence has become really high. So anytime we have mineral deficiencies, they are almost outright, then they start presenting with autoimmune disease conditions that are affecting the scalp. So it's quite it's quite broad, and as we screen, we really have to rule out these particular systemic illnesses before we narrow down to the particular hair loss. Remember, hair loss can be isolated just on the scalp. Remember, again, it can affect beyond the scalp. Your axilla, your groin, we only don't assess hair loss for the scalp. So it can be isolated or associated with either other medical condition. When it's associated with other medical condition, the shift becomes not necessarily to focus on the hair loss on the scalp, but also to treat these patients for the underlying issues. Mm-hmm. Yes.
Now, Kenya is witnessing a booming wig culture. We talked about the weaves, but let's talk about the weave culture. You know, the beautiful wigs. And you know, in Kenya right now, literally, you know, it's booming businesses. So in terms of what is fueling this culture, when you correlate it to hair loss, and even if there's no hair loss, the constant wigging, and now we know that there's gluing involved, a lot of perhaps use of gel as well. How could this potentially fuel hair loss?
And the statistics are right. Women are more affected, but they tend to present late because of the prosthetics you're talking about. By the time they're buying, most of them will not buy the wigs and all that. They're beautiful. We love them. We also recommend them as a protective styling. But when they're buying all this booming business of wigs, you'll find the biggest percentage of people are masking an underlying problem. There have been hair loss, but then there's no clear guideline on how to seek consultations on help for hair. Mm-hmm. But now the trend you're seeing, especially the gluing, is where as physicians or as practitioners we're concerned, because when they end up now, it's time to remove the glue, it goes away with a section of the hair. And that repeated action gives us what we're talking about, alopecia. So we have to be very careful. They are beautiful, they are nice, we're using protective styling, but how it's done is also very important. The gel, as you spoke about, I see, you know, the way we're trying to lay the edges looks really beautiful. How do we remove this? Because we always advise at least wet the gel or use some form of oil so that you remove the gel and can shampoo. Mm-hmm. But we've seen people mechanically trying to remove this gel and you break the hair. Yeah.
Talking about misinformation out there, what exists out there, especially around miracle products, we talked about, you know, the shock of actually repeatedly losing your hair and consistently finding that you're actually starting to bald, and especially for a woman or even a man, you know, a younger man, it must be traumatizing. So in terms of the misinformation out there around magical hair products, please demystify what works and what actually doesn't.
Most of the products we see on the shelves have gone especially so rigorous research, and they actually do work. But the issue is, at what point do you start using them, and at which particular condition are you trying to treat with these particular products? Mm-hmm. I like to give my patients an illustration. Is like you're gardening. If you go to the field and water the ground without any plant, there's nothing that will grow anyway. So if there is no hair follicles, the roots of the hair, and you're applying these products, definitely you don't expect to see any results. And that's when we have people getting very frustrated. We use a lot of funds, finances to buy the products. So by the time they're coming in for the consultation and we assess, through the trichoscopy or dermatoscope, there are no hair follicles. So they have spent a fortune on the products, which are really good products, but for the wrong reason. So I think the first things first for our people is seek a physician's consultation to establish whatever form of hair loss you're going through can actually be restored with these particular products. Yeah.
For someone at home just starting to notice that their hair is thinning, what is the very first step they should take? Let's walk step by step in terms of how to seek help. And indeed, how affordable or realistic this is for the normal Kenyan, for the average Kenyan.
For the average Kenyan, actually. It becomes more expensive the more we wait. But if we catch it early, it's simple. Catching it early means it doesn't have to be necessarily you're already seeing hair strands on your pillow or you're seeing hair strands in the bathroom. Things like scalp is burning, scalp is painful, you're feeling itchy, your scalp is flaking. This is a sign. It's a symptom, it's your scalp telling you there's something happening.
Yeah.
That is the right time to go and seek a health professional consultation. Be a general physician, could be a dermatologist, and a consultation will range anywhere between 1,000 shillings for this specialist to about 3,500 shillings. And they'll be able to establish what exactly is happening. Mm-hmm. The more we wait, the more expensive it becomes, because the earlier, the better. And if we have permanently lost hair, this hair, we can't recover it. Some of the hair loss is temporary, some of the other hair loss is permanent. So the moment they feel the scalp has something, it's asking for something, that is the right time to seek a consultation. Yeah. Not to wait until they can actually appreciate bald spots.
Yeah.
Yes.
Now, but before, even seeking medical attention, are there natural remedies right at home, right within your reach, that can actually lessen, and just make this less strenuous on the hairline, or whatever it is that's happening in terms of your hair loss? Are there natural things at home, daily habits that can help you see a better, we like having, what do we call it? We like having a good mane on our heads. Yeah. So home habits, daily habits that can help.
That narrows down to the hair care practices. What we said earlier, you have braided, it's 6 weeks, get off the braids and give your scalp at least 2 weeks break. At this time, you're shampooing, and particularly for African women, we introduce something even like antifungal shampoo because of the yeast. So shampoo your hair with the products you have at home, condition and moisturize. Let's remember the hair follicles, or the cells, they're just natural cells like any other. So they'll need that nourishment to keep growing. And that's basically what you can do at home. We have natural oils in our shelves which do very well for hair growth. Things like tea tree, rosemary, eucalyptus, scalp massage. And that will really come a long way in
And before we go into the new treatments or breakthroughs in the field of hair restoration, I want to talk about graying, the graying of hair. And so when we talk about at-home habits, just over-the-counter remedies, perhaps, the darkening shampoo, the charcoal shampoos, the dyeing of hair, extreme dyeing of hair if you start graying. And even for the younger men, when they go to the barber shops, there's this trend with dyeing your hairline. What the possible effects of that could be as regards hair loss, the extreme, leave alone the relaxers, but just perhaps let's link in the relaxers as well, which come hand in hand with the dyeing, mostly in the barber shops. Let's talk about those chemicals and the potential of hair loss.
The potential of hair loss. And graying, particularly, you can't prevent it. It tends to follow a genetic issue. You see people as early as in their 20s who are graying. And we always say we don't have a permanent solution for graying because it's melanin that is not coming to the hair. But the relaxers, all the potential chemicals we are using. Remember, our Afro-textured hair has a typical curl. And most of the time when trying to texturize, relax, we are trying to straighten this. And some of the downside to this is hair breakage, or the chemicals we are applying to the scalp, they end up inflicting things like chemical burns or trauma to the scalp. And eventually, sometimes later in life or even immediately, we start struggling with hair loss because the hair follicles is within the skin. So if there is damage to the scalp skin, quote unquote, then eventually we may end up having hair loss. The choice of the color and how often, the choice of the texturizer, how many minutes it's sitting on your scalp, and how often really matters in preventing hair loss.
Right, okay. And now we need to get into the new treatments or breakthroughs in the field of hair restoration. We had talked about what to do if you experience hair thinning, but in terms of breakthroughs in the Kenyan market, and we'll be looking at those images once again just to look at some of the procedures that medics, dermatologists are currently doing in the country as regards hair restoration. Walk us through those procedures.
Most of the trends that we're seeing, the platelet-rich plasma, hair transplants, exosome, polynucleotides, there are quite a number, but they are more regenerative. Okay, regenerative means they're coming into the environment of the scalp and making it healthier and enhance scalp or cells regeneration. But behind the regeneration treatments, there is a diagnosis. They're really good. They're giving us very good results. But something we don't like to miss is the right diagnosis for the cause of hair loss. Because the regenerative treatments we have cannot cure an underlying medical condition. Your doctor, your physician has to, appropriately treat this. Then we move to the regenerative procedures, which are really doing well. Like there's one I'm seeing on the extreme left, things like platelet-rich plasma, which is used alongside topical applications like Minoxidil, will end up giving very good results.
That is a topical application?
That is a topical application and local treatment. That's not a hair transplant.
So this is just basically a cream, a medicated cream that you'd apply?
Cream, some injections from the plasma, get their blood, then you inject. This only applies when we have viable hair follicles or we have viable hair. If you look at his before, there is quite some hair. And that is what needed to get hold of the thinning so that he can achieve the full head of hair.
So you say this particular image, you're seeing that there are viable health follicles on the top image.
Yes.
What does that mean in not such a technical term?
That means there is hair growing. He hasn't completely lost the hair to the bald extent.
So this is what you were talking about early days?
Early days, early presentation. He's a man, very young man, genetic, androgenic balding that we're talking about. So when we initiate these early treatments, then something else that needs to come in is the patient education, because he doesn't cease to be susceptible to thinning. So he might have to maintain this as long as he needs the hair growing.
Right. That is the application, the topical application.
It's almost an indefinite form of prescription until such a time he's confident it's okay, I can let my hair go and come back again for possible hair transplants. Right. So as long as there is hair growing, there are interventions that can get the hair going. When we move to now the extreme like that gentleman, you can see the transition is absolute. There's areas where he has hair and then this other section he doesn't have hair. So if we initiated any topical application where he doesn't have hair, we don't expect any results to come by. And that's how now the hair transplant becomes a prescription, where we get the hair from the back, the sides, plant, and the hair continues to grow. Yes.
To get the hair from the back, from the sides, that would mean you completely have to shave those sides and use that hair.
Yes. Okay. Not the hair that you've shaved, but we go deep into the scalp and get the grafts, the roots.
The roots.
So it's a medical surgical procedure. Right. We don't transplant the hair technically that we're seeing, but the roots, so that then it continues to grow.
Yeah, and healing, what are we looking at in terms of healing after such a procedure?
We say it's a medical surgical procedure, so there's also the prerequisite criteria in terms of screening for their health and whether they are eligible for this particular procedure. But there is a downtime of about 10 days. Right. 10 days, it's not because they're incapacitated, but it's visible. Most of the time, they don't want to go outside and appear in public. It's visible.
What of people who have keloidal skin? If you are, if you're taking, what did you call it? So you're not actually doing the hair transplant, you're taking the root. For people who have keloidal skin, I'm assuming that there's pricking that's involved?
There's actually punching and pricking and a lot of interferes with the integrity of the skin. Yes, so for people with keloids or keloid tendency, even with the family, because this is the pre-screening we're talking about, we disqualify them, unfortunately. Because the chances of them forming keloids and scarring that is more disfiguring after the procedure is more than them having to just stay with the baldness that they are going through.
Right. So that is another option. Any other option that we may...
We may have topical application, platelet-rich plasma. We have hair transplants. That basically it. Recently, we have things like exosome, polynucleotides. They are all regenerative medical procedures. Yes.
Now, we talked about people that are prone to keloids being bumped off the possibility of such a procedure. But what other potential side effects are we looking at when we look at regenerative hair therapies? What other potential side effects would disqualify a potential candidate?
Okay, particularly for hair transplant, if someone has an underlying medical condition. And we find that the risk of going in for this procedure outweighs the benefits of having this transplant, we disqualify. These are patients either who have cardiac disease issues, uncontrolled blood pressure, uncontrolled blood sugar. Remember, this is a wound we are going to inflict. So if they can't heal optimally, the risk is more than having the transplant be done. The regenerative procedures like the platelet-rich plasma therapy, they'll give us some blood tests before, because we are utilizing the science of the platelets in this blood. So if we disqualify them at that particular point, we suggest possible more options, safer. Remember, baldness or not having hair, as it would sound, you would still remain healthy. So if the risk is higher when you're trying to do the restoration measures than you should have been without, we just let it go.
Yeah.
Yes.
So the permanency of this procedure, once I get my hair restored, am I looking at a lifetime of a good mane, a healthy mane on my head, or would a patient have to repeatedly keep coming back?
Among the ones I've listed, the only permanent solution that we have mentioned is hair transplant, because you're just moving hair, and with its genetic characteristics, it's resistant to balding. But all other treatment options that we have mentioned earlier, you may have to keep coming back. You may have to keep coming back for more sessions, as long as we want to maintain this hair to keep growing. Yes.
We have talked about family history, and I just got a question here in terms of hair loss being hereditary, and understanding your family's history, especially for the men who tend to bald. So we have a family of bald men, and so potentially I'd probably be bald as a man or as a woman. So talking about family history, are there any preventive strategies that perhaps this viewer is asking that one can take if you do know that you have a line of family members that have experienced hair loss? Just protection before it actually happens.
Unfortunately, for now, they can see it, but hardly are we able to do the genetic typing. As a country or as a practice, we've not gotten to that level. But if you can actually see it within the first degree of the family members, your sisters, your brothers, or your parents, it's likely to happen. Other than the genetic balding or the androgenic alopecia we're seeing in men, there are other autoimmune disease conditions that tend to have a genetic history, right? And these classes of the autoimmune, I mean, it's your own immunity just attacking normal cells. In this particular case, the hair cells. Whatever I see, if you're my sister, if you had arthritis, I may end up having an autoimmune scalp or skin condition. It doesn't always relate that if you had arthritis as an autoimmune disease, I will get arthritis. I may end up having an autoimmune thyroid disease. I may end up having an autoimmune scalp disease. So this history is what helps us prepare these patients or these clients. If you can see it, it's time just to have a consultation with the physician. What are the preventive measures? The examinations guides us when you examine the scalp. Are you likely to be going through hair loss, or are you already going through hair loss? And we can start the preventive measures, like we said, what you can do at home, if there is anything to apply when this, and they are able to pick what to pick when it's happening.
There's a trend with the beard gang in the country. Dr. the beard gang, Timothy is here. He's got a nice full beard. And there are men who really struggle to get that full, nice, bushy beard. Others, for others, it's very easy. And I actually hear that there's some, beard care. They actually carry around a little comb. They've got little creams.
Beard oils.
Yeah, and oils. So they actually do take care of these beards. But for others, it's not as easy. So this is not hair loss, but it's just perhaps the inability to grow a beard. So what would you say to a viewer who's really, really, really passionate about this beard gang, but has been unable to join the gang?
They can join the gang through a beard transplant. It's doable, it's done. But if they are in their 20s, I like to give them up to the age of around 30. And I ask them, just look at your uncles, look at your father, look at the people around you. Because most of what we carry in terms of skin health anything tends to have a genetic lineage. So you'll see brothers from a single family, they really have a full beard. If you, perhaps your uncles, they don't have a beard. This is time that you reduce the expectations, but you still really need it. Beard transplant can help them join the beard gang.
Okay.
Yeah.
Now, in terms of breastfeeding, we know that pregnancy and breastfeeding has also led women the hair loss way, and there are concerns around the fact that some women actually never restore that hairline, or once the hair thins, that's the order of the day going forward, and with progressive and future pregnancies, it keeps happening. So what are the remedial options in such cases?
Okay. Yeah. The most fortunate about the hair loss during and after pregnancy is temporary, right? Those who never recover from it, chances are they had another issue underlying, and it was just masked by the pregnancy. Remember, during the pregnancy supporting hormones, they are also supporting your hair. So your hair tends to really thrive during pregnancy. And 3 months, 4 months post-pregnancy, that is when the shedding is very, very marked, because then the hormones are taking a dip. So we give them up to about 6 months post-pregnancy just to establish whether this hair is going to grow back now that their body is going back into initial state of hormonal changes. If that's not the case, then we start to investigate further. Remember, pregnancy in itself is a stressful factor. And the kind of hair loss that we have associated to stress tends to be temporary unless there's any other scalp issue that happened before. Remember the women biology we talked about. There is a pregnancy surge of hormones. They have taken a dip after delivery, and then the body has to readjust all over again. Even simple things like anemia. We see anemia most common in pregnancy, can also have them lose their hair. So we give them up to 6 months, reevaluate. Most of them have been put on post-pregnancy supplements, which really insist that they take, and then we can start evaluating for other possible causes of the hair loss.
Yeah, and we talked about some vitamin deficiencies, such as vitamin D, being a possible cause of the hair loss. In terms of some of the, so we talked about lifestyle, stress, diet. So practical, for instance, let's talk about, let's unpack this. So talking about stress, when you experience hair loss because of stress, is this something that would happen one-off, perhaps because of the stress, and then after perhaps you're in a good emotional state, then you get yourself back to your normal state of hair health? Let's unpack stress before we move into diet.
Okay. Stress, if a stressful situation occurs now in August, you're likely to start seeing hair loss associated to it about 3 to 4 months, right? Because the hair loss or reduction in hair density is just interfering with the hair growth cycle, which when stress-related hair loss, we anticipate it will occur between the 3rd and the 4th month after that. Secondly, if you have a medical condition that can be flared or triggered by stress, we talked about psoriasis, seborrheic dermatitis, eczema, that can also have you, go through the hair loss. Stress also triggers the autoimmune diseases. And the thing is, if someone knows they are not able to manage stress at a particular way, there is always that pattern. Today they're okay, and every time they go through a stressful cycle, they come in, Doc, I'm losing hair again. There are preventive measures that we can always take them through. We allow them to own the condition because they understand what exactly is happening. I'm going through this patch in life right now, a rough patch. In the next 3-4 months, I anticipate I'm going to lose hair. Stress also looks like crash dieting that we're seeing in women because of weight loss. Remember all these minerals, if you're losing them, if you start crash dieting now, I anticipate in the next couple of months, we'll start to struggle with hair loss.
Right.
Yeah.
We talked about diet as well. What can help, and what are we doing wrong as regards our daily habits and diet that could lead us this way, hair loss way?
Let me start with the funny conversation.
So crash diets, just to clarify, crash diets are actually a no-no in terms of hair health.
Yes.
You're definitely going to experience some hair loss.
Yes.
All right.
So diets or minerals that we acquire, we can acquire them in various ways. Take a look at the vitamin D, which is naturally given because of the sun. But then as dermatologists, our conversation is always wear your sunscreen, sun protective. And we've seen vitamin D deficiency being very rampant in the Black population. One, because our melanin does not allow us to convert, the UVB to vitamin D. Black population, again, we have a bit of lactose intolerance, the calcium-rich kind of things which helps us, absorb the vitamin D. So that again contributes to the hair loss. How many people, how many families can afford things like fish, which are rich in vitamin D? Very, very few. So when we have the conversation around diet, some of the things that are really important may be out of reach, but some things are readily available. We said of iron causing you, iron deficiency giving you hair loss. Iron, we get it freely from the green leafy vegetables, which is readily available. I think even someone in the villages and all that, they can get that. So anytime we have the conversation around diet, we always want to make it possible for these particular people to access. If it's inaccessible, then it doesn't make sense, and we end up have these things. So if it's vitamin D, you don't have to get to the supplementation. If you have to and you can afford it, better. If you don't have to, there's a way we curate your sun exposure in a week to a certain level that we ensure you're not deficient of these particular minerals.
And the supplements, if indeed you're dieting or for some reason you've got some diet limitations, there are people, like you said, who may have underlying health issues who are not able to eat just about everything. If at all you have diet limitations in terms of what you can and cannot eat, what are some of the supplements that would aid your hair growth?
Things like vitamin D supplementation, but we recommend that you pick with precaution. There are certain dosages that have to be under particular professional recommendation. There are certain international units that you cannot exceed on your way. Things like calcium supplements, iron supplements, particularly for women, those who have heavy flow or they tend to bleed quite a lot. Iron, vitamin D, calcium are very, very important for hair growth. Even things like the B complex, vitamin B12 and all that, they're all seen to have very good effect on hair.
And with the help of my director, if we have some questions, we'll be taking them shortly. But as we start to wind up, a lot of people see hair loss in terms of people seeking options of restoration as a cosmetic issue. Could you safely look at this as a public health concern in terms of what we're seeing as regards numbers and people who are actually seeking help?
It actually is, because we said as we started, people always associate it to vanity, cosmetic appearance. But trust you me, most of the patients I see, other than the hair loss, when we go deep, we find the diseases that we have been discussing. So then it becomes a collaborative effect. I'll treat their scalp, but I end up either referring them to a physician, rheumatologist, because this was a symptom. And remember, most of them are painless, but it just masked an underlying medical issue. So same way we have a fever, because a fever tells us there's something happening and we rush to the medical professional for assessment. If you are experiencing hair loss, it's time to just get checked. Could be something beyond just isolated hair loss issue, but a medical issue particularly.
We talked about the wigs actually covering up this. I mean, for a lot of women, it's about the beauty, a new look, protective hairstyles. But for others, they're actually covering something. And even men nowadays are wearing wigs. But let's talk about the cost of treatment and of the hair restoration and why wigs then are an option for a larger part of the population. Is hair restoration affordable? What are we looking at in terms of the margins and the options?
I'll say it's not very readily accessible in terms of pricing. Taking the case scenario, if you're looking at a hair transplant, maybe the minimum figure that you get for such a procedure is about Kenyan shillings 100,000.
And this is a one-off?
It's a one-off procedure. The things like platelet-rich plasma therapy, we are talking about per session, you're looking at anywhere between Kenyan shillings 10,000 to 20,000. And you're going to have these multiple sessions, right? So if you were to have the outlook of hair loss, it's better picked early, because we then halt the process of getting into restorative measures. And then that's why the wig becomes an option if someone cannot afford. That particular treatment option is a hair transplant, 100,000, then the wig becomes a better option. But again, behind, they're still struggling with the emotional impact for hair loss.
Talking about, we're taking your questions very shortly. Talking about protective hairstyles, we talked about the box braids being a safer option because they're bigger and perhaps not as harsh on the hairline. We see Africans now going back to their roots, the sister locks, the dreadlocks, perhaps even the finger curls. So people really embracing the natural African hair. Would you say this is a safer option in terms of protecting your hair health in the long run?
Totally, and I'm very excited as someone who has keen focus in hair loss and scalp diseases when I see someone just showing up in the office with an afro, beautiful afro look, finger curls, sister locks, because that means they hardly have to have their scalp manipulated. There are better options as compared to persistent and consistent weekly or every 2 weeks braiding. You remember the background is that because of the afro texture of our hair, that's why most of us, even those who grew without long hair, it's very hard to manage the typical curl. So you either want a relaxer, you want to braid it, or you want to texturize it, because you feel it's very hard to comb. But if you can innovate around it, the better. Your scalp will be safer.
Right.
Yeah.
Thanks for that. Let's take a look at a few questions. Right, as we wait on those questions, some of the common myths, the most common that you've had people talk around hair loss, what are those? And we're not talking about the typical thing of kwetu hatuna nywele, you know. We come from a family where our hair is just not there. So what are some of the common myths that you'd like to dispel right now?
I think the biggest that I've seen, and even the recent trend around men, is that anytime you're seeking for hair restoration or hair treatment, you're going to have sexual dysfunction. Because they tend to associate, of course, the androgenic alopecia in men is associated with the androgens, the testosterone hormone. So they fear, if I start any form of treatment, it will end up getting me into the sexual dysfunction aspect. Right. While they might be true, because some of the ingredients, if we were to completely halt the process, would give that. We, especially as an African culture, don't use such treatment for hair loss. You will see it even on the internet. If there's a conversation around hair loss, you will see them discussing, if you start this, you're not going to be functional in future.
But that's not exactly
It's not the case. It's not the case.
Thanks for that. Let's take your questions now. They're ready. There you go. Can coconut or castor oil, castor, I believe they meant castor oil, improve hair growth? And there's another one. I've been taking care of my hair for 4 good years, but it is not enough for my little finger. What should I do? I have sideburns on my face. What can I use to remove them? Wow. So let's begin with the sideburns. Sideburns, so this is beard gang as well. But I don't know if this is a female or a male. Did we have the name? It's a female. Yes, so a female talking about sideburns, and I've seen those. So the women who have the hair that extends down below the earlobe, she's uncomfortable about that. How to go about getting rid of them?
Getting rid of them, most of them we recommend non-invasive options like dermaplaning, just the way it's cleaned and shaved off the skin. It could be as a genetic issue. That is how their hair grows. But again, we also see side bands growing alongside chin hair for women who have
and
hormonal,
mustaches.
or hormonal related issues. So if it is associated with any other form of hair growth, especially on the chin, or things like acne and all that, we could be looking at a hormonal dysfunction issue that needs to be checked. But it's just actually, it's when they are small children and they could actually see that dermaplaning is a good option. I really shy away from things like waxing because of the possible effects on the skin, but dermaplaning is a safer option.
Right.
Yeah.
Somebody talking about taking care of their hair for 4 years and still saying it's not even the length of their little finger, meaning that they've really, put in time in terms of that hair care. What are they doing wrong?
They could be doing everything right, but the length of our hair is genetically wired. Our hair grows to about 1 centimeter in a month, but for some people, the growth phase is shorter. In context, you see, like the hair on our scalp is longer than the hair we have on the either lashes or anywhere else. This is usually determined by the growth phase of our hair in the growth cycle.
Yeah.
So they may not be able to change it. Some of us will have really long, beautiful hair, and some of us will really struggle even to get that 1 centimeter or 2 centimeters. So it's
But is long hair healthy hair? Is thick hair healthy? When we talk about healthy hair, what is healthy
we
hair?
mean the length and the length and the shortness of the hair doesn't mean healthy.
Yes.
The health of the hair means it's the scalp is healthy. Your hair is not breaking in terms of the texture and the gap and the color. It looks okay.
Right.
But your length, if you Lillian have really long hair, it doesn't mean probably you have better, healthier hair than myself who has shorter hair. That is just who we are. So I would like to know if either they had been taking care of their hair because they were losing hair, or they were taking care of their hair just to improve the length. Because the length of the hair, then they might not be able to do it if it's whole genetically they are.
Right.
Yes.
So the other question on the coconut and castor oil.
Yeah. They improve the scalp health. They particularly improve the scalp health and look at the hair like something that is growing from a particular environment. I like to call it the scalp health environment. So if the health of the scalp is okay, your hair will grow naturally fine.
Yeah.
But we're not using the coconut or castor to treat hair loss. That is a distinctive difference. Use it to improve the scalp environment, but not to grow hair.
Right.
It will work.
Now, a question here, final question, is on lashes. there's the strip, the lashes, the eyelashes, the strip that ladies tend to put on, when they do their makeup, or even the more permanent single lashes that last longer. So there's the everyday strip that the ladies peel off, when you want to wash your face, and then there's the other individual lashes that you can have for as much as a month. All these use glue. There's the application of glue. Potentially, somebody here is saying that they've seen that their lashes are less. They don't have a nice full bed of lashes. Please, let's talk about that.
Yeah. So the lashes, especially the one you strip off because of glue, could end up going with some of your individual lashes, right? And then there is the individual ones that you wear for a relatively longer duration of time. I'll go for the ones that you're sitting in for some time. Because if every day you're stripping off these lashes, other than you losing the fine lashes hair, you also have a conflicting environment in terms of skin. You're likely to have some form of reaction on that particular area and you end up losing the hair or having some inflammation. Maybe you've seen someone swell after the installation of lashes or something.
So safer to have the individual lashes that last longer.
Yes.
Okay, Daktari, we're closing now. People are asking where can they find you for further consultation?
My practice is Jalada Aesthetic Clinic. We are located at the Family Health Plaza along Langata Road at the Timol Junction, but they can reach us on phone 0719 458 689. 0719 458 685. I think I got that wrong, but we can write it down.
No, I can allow you to say it one more time just so that they get it right.
0719 458 685. I think I got it right.
Right.
Yes.
And your final words as we close on hair loss and the fact that there is hope for hundreds of Kenyans out there who have struggled with this for years.
Right. Hair is not vanity, or seeking hair restorative treatment is not vanity. The same way we take care of our health, we should take care of our hair. Let's listen to what the hair could be communicating. Could be an issue or isolated, or there are no issues. So anytime we see that something is going off wrong, let's seek a consultation. And there's help as early as enough. Yeah.
I have a quick question here. Oh, goodness, we are out of time. Sorry, we'll have to take those away from this session. But I'm so glad you joined us in studio. That's a very informative conversation we had today. Dr. Winnie Maina is a registered clinical officer and dermatologist. We've been talking about hair loss. August is Hair Loss Awareness Month. Remember to take good care of your hair. And if you need help, there are professionals available to guide you through that journey. Thanks for watching. I'm Lillian Muli. Have a lovely day.